When I was diagnosed with prostate cancer, the doctor that I was seeing at that time gave me a prescription to get 2 tests done, CAT scan, CT scan. Afterwards, he told me to call and make an appointment for cancer treatment. When I called them, they told me I had to wait for 2 weeks for an appointment because the doctor was just too busy. I had known that Referral Regional Cancer Center was here because I visited a friend. I gave them a call. That was on a Friday. On a Tuesday, I had an appointment to come here.
People are still free in this world. They're allowed to go where they want as far as choosing a doctor is concerned. But what normally happens is you go to the doctor and you end up with the unfortunate diagnosis of cancer. It's a major thing. And the doctor then refers you for treatment. And unfortunately, the way referrals are conducted, to a large extent, have very much to do with the doctor's own financial and political agenda, or the doctor's actual business arrangement. So, for example, if you're diagnosed in some big institution, the doctor at that institution is not going to say, well, you need radiation. Let me think. Who's the best possible radiation oncologist for you to go to take care of this? That's not how things work. The administrator at that hospital, or the administrator over that hospital system, because they're now systems, they're huge, multiple hospitals, is pressing their thumb good and hard on the doctors. They've got to keep the patients in the system. They've got to generate revenues. So they're not going to send you to where the best place is or to the best doctor. They're going to keep you in-house because they want to keep the revenues up in the system, in the hospital. They're going to say anything they need to or have to, and they've usually got some good talking points if it's in a particularly competitive area, and they'll do what they have to do to keep you in the system. So they're not going to necessarily make a referral out. They're going to say anything to keep you inside. They're going to say, oh, you shouldn't go to see Dr. Karp. He's out there in Rahway, New Jersey. You should see our doctor. That way we're all together here and we're working together, as if there's some benefit to you going to some facility inside the basement of some hospital and get treated, and your medical oncologist who gave you chemotherapies in another part of that building, who knows nothing about radiation and has nothing to do with that aspect of your care, somehow that's part of the coordinated effort in taking care of you. But that's not the case at all. They're just keeping you in to make the money. And another area where this is very key is prostate cancer, where unfortunately what's happened is urologists, who are the doctors that diagnose prostate cancer, have financial relationships with radiation treatment centers. So when you're diagnosed with cancer, where do you think they're going to send you for your radiation? They're going to tell you, you have to go to this place. And it's a place that they are financially associated with in some way. And one thing that's very important to keep in mind, if you're being sent somewhere that has some sort of guaranteed flow of patients because the doctors making the referral have some sort of incentive to send you there, whether it be urologists or, for that matter, hospitals, where the hospital administrators are, for all intents and purposes, pressuring the doctors to keep the patients in-house for the radiation. In settings like that, you really don't have much of an incentive to maintain quality because you know you're going to get the patients no matter what. So it's actually a situation that promotes a poorer quality of care. Now, we're what's referred to in this world as a non-aligned center. We're independent. We're not part of any other entity. We have no financial relationship with anyone. We don't pay anyone for patients. There's no incentive to send patients to our facility other than the fact that the patient is going to get great care. That's a very important thing for you to understand, that when you're coming here, you're not coming here because someone's getting something out of it.